Welcome. This is Pam Bartha. Today we're going to be talking about part 3, which is multiple sclerosis is an infectious disease, and we're going to be focusing on MS and filarial worms. This is a very important topic because a very well-respected pathologist, Dr. McDonald, he discovered small nematodes, very small roundworms in the spinal fluid of every MS subject that he tested. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed over 30 years ago, actually over 35 years ago now, with multiple sclerosis, and I was given no hope for a cure at the time when I was diagnosed. I was told that I would be completely disabled, that there was nothing I could do to change the course of my life, and boy, were those experts wrong. Since then, by the grace of God, I've had the amazing privilege to coach many people, like thousands of people all over the world, because I have been studying this topic and I've been, for my own sake also, but once you get your health and your life back, then for me, it's all about wanting to pass this forward and help others to get their health and their life back also. So this is not just for multiple sclerosis. This is relevant for anyone who's dealing with any type of neurological disease. Like, it's something that we need to rule out because these small filarial worms are fairly common. So today we're going to talk about how we get these filarial worms, what Dr. McDonald discovered, how these worms impact our health, how they cause neurological symptoms, how to test for them, and how to treat them. So I'm going to highlight a few things, and then I do have previous videos that I have done on these topics, but I'm reviewing this again because this is such an important topic and we don't want this research to die. Unfortunately, there's not a lot of money in treating parasites, and so this kind of research is not really being picked up by a lot of other different researchers, like to confirm or dispute Dr. McDonald's findings, because let's face it, a lot of these studies, they cost thousands and thousands of dollars to run. And if there is no promise of a patentable drug at the end, then a lot of researchers are not going to have the funding from pharmaceutical companies, because why would they want to cure people with, and this is just business, right? It's not nothing, there's no conspiracy thing here. It's just like, if you have a business, would you rather have a customer that you help them to recover and it's like $5,000 or $10,000, or would you rather have a customer for life where the treatments are over $100,000 a year? That's kind of a no-brainer. So that's the problem, is that our healthcare system is really gridlocked right now. We are not helping people. We're not looking for a cure anymore. We're looking for new patentable maintenance pharmaceuticals, and that's why his research has not been followed up. And I believe Dr. McDonald should get an award. He should get a huge award for the discoveries that he's made and his work, his research. He didn't have to spend hundreds of thousands of dollars studying this. He did these studies on a very conservative budget, found out a lot of evidence that is life-changing for us. But it's people like myself and people like you that have to forward this research to other groups, other practitioners, to start getting discussions going, to start generating interest. We need to fund different types of research, right? We don't want to keep funding these studies that are going towards these disease-modifying maintenance drugs that keep us sick. We want to definitely be funding different institutions, research, PhDs, etc., that are willing to look for a cure. They're willing to look for the cause of multiple sclerosis and other diseases. So what are filarial worms? Filarial worms are very small roundworms. There's adult and there's larva. So there's adults, and the immature form are called the larva. There's at least 8 different types of these filarial worms that infect humans. They can cause disease in humans. And so we're going to talk a little bit about some of them, like how they impact us in our health. So they're very slender roundworms. You can't really see them with the naked eye, especially the larva. So the adult form, they could be anywhere, 2 to 10 centimeters. They could also be like the size of the dot of a pen. So it would be really hard to see them with the naked eye. The larva would be this diameter of a red blood cell, a little bit longer. Also, they're thread-like, but again, very, very small, and they're transmitted to humans through biting insects. So not just ticks, but ticks, mosquitoes, and other biting insects, black flies, etc. There are different species or different cousins of these worms that can infect humans. And really, depending on what type of worm infects us, they all like to live in different parts of the body. So, for example, some like to live in the eyes. And one disease they can cause is river blindness. They can also live in our lymphatic system. Maybe you've seen pictures of elephantitis where you see that like the lower limb becomes like really, really swollen in a person, like their legs, etc. Also, skin. We can have rashes and we can have changes in the pigmentation of our skin. Also, in our intestines, they will live. And of course, that goes with a lot of gut issues. Blood vessels, you can actually find them in blood vessels and also in the central nervous system. And that's where they're going to cause a lot more of the neurological symptoms. So really, again, depending on the type of filarial worm, like there's different cousins or species, that really depends on if it's going to cause something like arthritis or rashes or changes in pigmentation in the skin, abdominal pain, fatigue, and in animals studies, we know that they can cause a lot of different types of neurological symptoms. Symptoms that are super, super similar to multiple sclerosis and other neurological diseases, such as extreme fatigue and tingling, numbness, balance issues, spasticity, drop foot, weakness, paralysis, and other neurological symptoms. So veterinarians have known this for over 100 years. So it's so crazy that if vets knew this for over 100 years, that these small roundworms in the central nervous system of domestic animals could cause similar or identical symptoms to multiple sclerosis, then why has nobody suggested? I mean, there was one researcher a long time ago that said, they're very similar to like MS. I wonder if there's some connection, but nothing has ever been followed up. So there is one Ceteria digitata, that is one type of filarial worm, and they know that it can cause fatal cerebrospinal nematodiasis. So cerebrospinal means like in your spinal fluid. Nematodiasis is like Isis is like a disease, inflammation, and nematode means the roundworm. So that very small filarial worm. So they know that, and they know that it can be fatal in goats, sheep, and horses. Again, over 100 years, veterinarians have known this, that these filarial worms, when they can get into domestic animals like dogs, cats, sheep, horses, goats, cattle, and I think that's it that I have here, but they can cause symptoms, again, of extreme fatigue, tingling, numbness, balance issues, spasticity, weakness, paralysis, and death. So it's just bizarre that nobody has ever, especially if the vets know this. And I honestly believe, now that I have quite a number of animals, that a lot of the vets in our area, they really don't know much about parasites. They know, oh yeah, you should deworm your horse, once or twice a year, and your dogs, sure. And then some vets are like, no, you shouldn't deworm too often. So I'm seeing in multiple different veterinarians, and one of them even, he's like, oh, let me go online and see what kind of parasites are in this area. And I'm like, really? That's how you determine how to deworm my pet? Like, can you not do like a stool test or something? Or is that it? That kind of looks like shooting in the dark. So unfortunately, I think that a lot of our veterinarians have really not been recently taught about how significant parasites are in the health of animals, right? It's almost like with animals, they're moving towards, like with humans, it's like, oh, your immune system is overreacting. We should definitely give you some maintenance drugs to manage your symptoms, live with your symptoms, try to mitigate the symptoms. And we don't know what causes it, and there is no cure. And they don't realize that parasites cause disease. And your immune system, when it's working really hard, its primary job is to treat parasites, to treat infections. That is its primary job. So Dr. Alan McDonald, again, a pathologist, I believe he's in the United States. I have so much respect for him. And he has other discoveries too. Very quickly, he discovered Borrelia in the spinal fluid, in the central nervous system of MS patients. We talked about Lyme disease in the past, so that's the bacteria that causes Lyme disease. He also found developing tapeworms, the larvae of tapeworms, and developing worms themselves, tapeworms, in the spinal or the central nervous system of MS subjects also. So he is amazing, and he doesn't have any influence on, oh, you should not be studying that. He's just a really good researcher. He's also discovered the Borrelia, that bacteria that causes Lyme disease in Alzheimer's patients. So his specialty is really in understanding and studying Borrelia in different types of diseases, especially in Alzheimer's. But then he discovered, because he shares that, if you look at any laboratory in any hospital or these med schools, they routinely do not look at blood. They don't look under the microscope. And it's just crazy. So our doctors, I believe they're not even allowed to have microscopes in their office. So now when you look at our healthcare system, how it is structured in a way that it keeps our practitioners ignorant. If they could look at your blood, I know they don't have time right now. I know that they're super busy with, seeing one patient after the next, every 15 minutes or so, or 10 minutes. But doctors used to be able to look under the microscope, and if they were allowed to do that, they would see these critters, and that would really help them to understand why their patients are dealing with these kind of symptoms. So Dr. Alan McDonald, he got specimens. So these are the remains of confirmed multiple sclerosis patients that had MS. They had a confirmed diagnosis. They died, and their remains were preserved in blood banks, or I should say in brain banks. And he was allowed to use that material to test. So he was allowed to look at the spinal fluid and the brains of people that had confirmed cases of MS that died. And so there's no ambiguity there. It's for sure MS patients. And he found many, many small roundworms in the spinal fluid. And he said that he didn't find a lot in the brain tissue itself. So the worms, they might cause some damage in the brain tissue, but then they move on. And so it was really hard to find them in brain tissue. But he said it was easy to find them in the spinal fluid of every single MS subject tested, 100% of them. So he found the adult worms, he found them in clusters, he found them mating, he found little larvae, possibly eggs. I can't remember if he found eggs, but for sure larvae. And he also found when these worms live in your central nervous system, they leave behind a lot of their waste material. So a lot of chalky gunk left in the central nervous system. So one of my students shared with me this week this really awesome little clip, and I'm going to see if we can share it on our Facebook, because it sometimes an image or a video can really resonate, and it can just really explain things well. So it was a slide of all these little worms, and they were moving around just calmly. And this is on a slide, so looking under a microscope. And then they took the juice of an onion. So they used a garlic press, and they squeezed some of the juice out, and they used a little dropper, and they put a couple of drops of the onion juice on the slide that had all these worms on it. And then all of a sudden the worms start wiggling and wiggling, like they're like, oh, we're dying, we're getting poisoned. And that we have to understand is when we're treating parasites, that can happen. And then we call it angry worm syndrome. And then several minutes later, a lot of them are dead. So sometimes there are better treatments than other treatments. Sometimes it will torture the worms and then they're wiggling really hard. They could be releasing more toxins, and then that's going to definitely trigger our immune system to go, hey, what's going on here? Because we know that a lot of these worms, they have many ways that they make themselves blind to our immune system. We call it immune dysfunction. So our immune system is not like totally dysfunctional, but it's like they have tricks. These worms have special ways that they can evade our immune system. They can make it so our immune system doesn't deal with them. But then once they're starting to die, then the immune system goes, oh my gosh, look at this. We've got to go after it. And the symptoms that we get, the neurological symptoms, the inflammation, that's really coming from our immune system going, oh my gosh, I need to go after this. So it's not like just worms that are causing symptoms, but the symptoms that we have are inflammation, and inflammation is your immune system fighting. So the immune system is going to fight the parasites, but also the toxins that they produce. And they can produce a lot of toxins. I would say more so than what we would get from our environment. So Dr. Alan McDonald, again, he found these small roundworms in abundance. I do have a link to his presentation where you can actually watch his lecture on this topic. If you go later on to livediseasefree.com, in the main menu under research, MS, evidence that multiple sclerosis is an infectious disease, go under parasites, and you'll see a direct link to his presentation there. And at the end of the week, I will be sharing a brand new blog post. And on that blog post, that's like an article that I write. It'll have my notes, all the notes that I'm sharing with you right now. Also links to his poster, his research poster. And also I'll be sharing like pictures of these worms. So you'll be able to see how they are mating, and they're in clusters, and you'll see the larvae. And it's truly fascinating. And I encourage you to share this research with others. And I think that a lot of people have these filarial worms. It's just the degree to which we have them. Like if we have like little muscle twitches, have you ever had like maybe on your leg or your eye even, like just this periodic like twitch? Those are definitely early signs of parasites. So we can have, fatigue for sure. So we can have these little warning signs for years before the population of those parasites becomes so great that we end up getting a disease label. And again, what is so frustrating is that the 2017 McDonald criteria of how we diagnose and treat multiple sclerosis, so the experts behind that criteria, they're not interested in any of this research. They're not interested in like proving him wrong. They're just like, no, we really don't care. We don't care what causes the lesions. We don't care what causes the antibody bands. We just want to give people a diagnosis and give them disease-modifying drugs for as long as their body can handle it, or as long as the patient will accept it, one of the two. And then you wonder why. Why is nothing changes? Why are they not talking about curing? Why are they not interested in proving him wrong, in showing that there is no such thing as live parasites? So Dr. Alan McDonald is the very first researcher to find these worms in the spinal fluid of humans and animals. Like that has never been done before. They found, remember I said the vets or the researchers over 100 years ago, they found some of these worms in the brain tissue, but they've never looked for it. Isn't that bizarre? They've never looked for it in the spinal fluid. And so how many of you have had a spinal tap? How hard would it have been for them to just check, right? If they actually knew, had a little bit of skill with staining, for example, because sometimes you have to stain to actually see things. But I think with these worms, you don't have to always stain because they are definitely bigger than bacteria. So how many of us have had a spinal tap and they had the perfect opportunity to look for different types of protozoa, bacteria? So simple, because we know that's the primary job for our immune system, is to treat infection. And if we have all of these lesions, I've done so many live topics for you. I've done one where I showed a whole bunch of different parasites that they know cause lesions in the central nervous system. So this is research. They know that parasites cause lesions in the central nervous system. They know that the central nervous system is not a sterile environment. They know that the primary job of the immune system is to go after parasites and infection. Why are those experts not interested in looking for infections? Why? That is a topic you need to start having discussions about in different groups. You need to start asking your practitioners, not just the neurologists, but you need to start asking your chiropractors, your nurse practitioners, your functional medicine doctors, and we need to start having them and share this research with them. It's so incredibly profound. That is why I keep bringing it back to the surface, because I don't want it to get lost. It can't get lost. This is people's lives. So again, he was the first to observe these nematodes in the spinal fluid of MS patients and to confirm between these filarial worms and also the tapeworm larvae and developing tapeworms and Borrelia. So he's the first researcher to ever discover live parasites in the central nervous system of MS patients. There are other researchers that have found different bacteria, but nothing like these other parasites. So he explained that these worms, they move around, they create a storm of injury as they go. Of course, they would create a lot more destruction than a bacteria. Bacteria are way smaller than these worms. So he said it's kind of like the tail of a comet, the destruction that these worms cause in the central nervous system. And so again, this is really big. Is like, why are our doctors not able to, why aren't they trained to look at our blood? Why are they not trained to examine our blood for different infections, right? It's not that hard. I did a little bit of training years ago when I just came out of high school, like at, I can't remember what it's like, microbiology and staining and looking under the microscope. Not that difficult at all. And then some practitioners, they do live blood analysis. And some of our students that we work with, that these practitioners that have done live blood analysis, they do find these nematodes in the blood. One thing I wanted to mention too is that years ago, one of our students in the Live Disease-Free plan, she's from Europe, and she was a pre-med student at the time. So she looked at her blood and she looked at the blood. And this was before Dr. Alice McDonald's research came out. She looked at her blood and she looked at the blood of another friend or person that she knows, and just a finger prick, and she found the nematodes easily with a finger prick. Amazing. So she sent me those pictures. She said, you can't share them because I'm doing a study. I haven't been able to find her study yet, but she did. Apparently, she was working on putting all her images and her study together. But I do have the images, and she said it's really simple to find them with a finger prick. But try to get a test in Canada, probably in the United States, it's pretty difficult. Why is that, right? Why is it so easy to get an MRI done, and how many dollars is involved with that? Or to get a spinal tap, how many dollars? Even these, the stem cell transplants, like $150,000. And what would a finger prick cost, right? He just can't make this stuff up. It's just insane. So again, our med students, our doctors, nobody is looking under the microscope. They're not analyzing blood for these types of parasites, and that's why it has totally been overlooked. And I believe that somewhere along the line, I don't, like all the doctors that are studying, I don't believe that there's any ill will on their part. They're just doing what they're taught, right? They're going to school and they're learning what they're taught, and they're told you can do this and you can't do that. And so they stay in their lane and they do exactly what they're like, incredibly compliant people, and they probably care a lot about us, but they're trained in this way that is not helping people. It is helping companies, but it's not helping people. Not, and I shouldn't say all, like I'm not against all pharmaceuticals. We use them to recover from parasites. So it's just when we're taking chronic disease and we're not treating the cause, that's the problem. When we're relying on immunosuppressive drugs for the rest of our life, That is the problem. And this includes all autoimmune disease, this includes heart disease, this includes cancer, etc. They're all infectious diseases. So back in 1880, that's when the researchers already knew that when these worms were in domestic animals, they had symptoms identical to multiple sclerosis. 1880. So let's talk about treatment for filariasis. That's a tongue twister. So when you're looking at treatments, you have to understand that not all treatments will treat the larva, the immature form, and the adults, right? So I was going to say, type your questions in the question box and I will answer them when I'm done here. So this is something that, if you've had live blood analysis done, then, or some other way, and you found that you do have these filarial worms, then just know that you have to consider, the treatments. Number one, it is challenging to treat a chronic parasitic infection because they get deep into the tissue. They're very happy there, and they have eggs. They hide under biofilms. They can often lay many eggs at one time. And so all of these factors really impact the treatment plan. And we have to be aware of it and we have to consider it. So there are drugs that are used to treat filariasis. And really, I'll tell you, like there's ivermectin, albendazole, and DEC. Also praziquantel, that's one I didn't realize. So praziquantel, it treats the flatworms, but it's more like a kind of like a detergent substance, and it will kind of erode away at the outer covering of worms, and that'll make them more susceptible to our immune system also, and probably make it so they can't live as well. Levomizole, fenbendazole, and moxidectin and others. So some of these, I know that we use them on our animals, right? And if you have animals, sometimes you get parasites from your animals. Not always. You can get parasites from produce. You can get it from eating any meat or vegetables. You can get it from in gardening, from partners, your spouse, going shopping, eating in restaurants. They're part of life. And so we have to understand that just as we would treat our animals, we definitely need to treat ourselves periodically. So the one thing that I have found, and with our own experience in helping our students recover from these types of parasites, is that just using one drug doesn't cure people. So this is where you have to use a combination of treatments is much more helpful. So some are saying that a combination of ivermectin, albendazole, and DEC is that some researchers are saying. Also, albendazole, ivermectin, and praziquantel is another good combination. DEC is a little harder to get access to, even for practitioners in a lot of different countries, but praziquantel is pretty safe. It's got a very safe track record, and it's more available. Again, it's not super easy to get access to these. You have to basically work with a practitioner to get a prescription. So our students have had a lot of success in recovering from MS and other diseases. Oh, and before I forget, I should mention too that there are herbs that can be helpful. And when we are recovering from these parasites, we use a combination. So in the Live Disease-Free plan, it's very important to get ready to treat. So first of all, we follow the Live Disease-Free diet, which you can find on our website under research. The guidelines are there. And we decrease our carbs a lot because these worms and all other parasites, they thrive on carbohydrates and simple sugars. So as we decrease the carbs, remember I was talking about how they wiggle and wiggle when you put poison on them? Well, if you don't give them a lot of food, they're more quiet. They're not going to wiggle as much. They're not going to produce as many toxins. The immune system gets a little bit of relief and we start to feel better. And then we want to make sure we're having daily bowel movements. We want to make sure we're sleeping well. And then we can start. So if we've had a lot of symptom improvements with those three things, then we can start treating. We still do other things to improve. It's called the prep phase. But those are the three big things that we don't start any antimicrobial herbs and or oxygen therapies or garlic or anything like that until we have daily bowel movements, we're sleeping well, we're not sleep deprived, and our carbs are so low that we've noticed significant symptom improvements. And then at that time, we can start to bring in herbs. So I discovered neem is one. There are some other herbs. I'm going to do more research. I will put that on the blog post also. Those are things that you will have access to more readily. But again, they're not going to be, it depends on how sick you are, right? And I should really share a disclaimer that everything I'm sharing right now is for educational purposes. I'm not telling you should use any of these drugs. You have to work with somebody. There are negative interactions between herbs and medications, maybe between the medications you're taking and parasite treatments. They can make you very, very sick if you don't do things in right order. And if you don't prep, if you just like, I'm just going to wing it, I'm going to get access to this drug and I'm just going to take it, you might find yourself feeling really, really sick, nauseous, throwing up, laying on the couch. So, like, you really want to, if you want to recover, you really need a plan. You really need support. You really need to work in a very strategic way, in a safe way also. So with the treatments, like we use a combination of antimicrobial herbs, parasite drugs, and oxygen therapies. So there are things like ozone, which is great, but it's super expensive. We did recommend it years ago, but we have found a much more cost-effective oxidizing agent, which I can't talk about here, but you can find it on some of my videos on our website. If you just do live disease-free and treating parasites with oxygen, or I think that's probably the best search. And you'll find the video, you'll find our blog post, and then you'll be able to learn about that oxidizing agent. It's super, super cheap. It's super safe if you know how to use it properly. And it's really important because the parasite drugs are not, again, they're not effective enough to really clear our body of these. Yes, to reduce them. There's always a risk, of course, of the parasites becoming resistant to these treatments too, and that's why you definitely want to use an optimal dose, of course, under supervision, an optimal dose, and a layering of therapies using a combination of treatments, and not just a combination of drugs, but bringing in like oxygen, because a lot of these parasites can't handle oxygen. That's what our body also uses to treat parasites, and herbs. So the combination of all three together, plus the prep phase, plus building a healthy lifestyle, is where people are having these miraculous recoveries. So it's not like pop a pill and get better. I wish it was that easy. We could cure the world, but it's not that easy. And one other thing to consider too is that when you have a lot of symptoms, you're feeling awful, you're just tired all the time, you might have depression, you might have anxiety, you might not sleep well, you're starting to get neurological symptoms, you're starting to worry that you might have some disease that you're going to be diagnosed with, please consider your microbiome. The microbes that live in your body is very similar to a lawn, your front lawn, your yard. If you don't take care of your lawn and you, let's say, let it dry out a little bit too much, some grass will die. And what moves in? So like that's like us. If we take antibiotics even once or twice, that really decreases the health promoting microbes in our gut, in our digestive tract, and then we are susceptible to whatever parasites are in our environment. So then we don't just get one parasite. We don't just get filarial worms. We might be exposed to filarial worms by biting insects. They get into our blood. And some of them will move into the intestine. Some will move directly into different tissue that they like to live in. But we can also get different roundworms, big roundworms, tapeworms, flukes, different protozoa, like we've been talking about babesia and malaria. We've been talking about, I didn't talk a lot about giardia, but that's super common in North America. It doesn't just cause diarrhea, but it also causes constipation. So there's bacteria, the Borrelia, and many other E. coli, many other nasty bacteria. So that's what a lawn would be. You don't just have dandelions in your lawn. You're going to have different big and small weeds. And in our gut, in our digestive tract, when we're at that stage where we're, pre-diagnosis, we have a variety of parasites that are causing problems. So we're talking about one today, but that doesn't mean that treating filarial worms will cure multiple sclerosis, because in our students, I've had pictures this week. I'm going to do one of the next parts is larger worms. I'll be sharing crazy pictures that I get every week from my students. Like, it's just like, how can we be alive when we have these worms living inside of us? And for the vast majority of us, we notice a really significant improvement in our health when these worms are coming out. The only time we might not notice a significant improvement is, let's say if you had 20 of these worms, like really large, up to, a foot and a half to 2 feet long. If you had 20 in you and you got rid of one or two, you're still not going to notice a really big change until you get down to the I've passed 10 or 15 or 20 and I'm like, oh my gosh, I'm starting to feel like I've never felt this good before in my life. And so that's the whole thing. So for the filarial worms, these are tiny. They're like the dot of a pin or smaller. These are the ones you can't see. So unfortunately, when you do an enema, you're not going to see them when you pass them. And a lot of them, if you have neurological symptoms, they will be living inside your spinal fluid and inside your central nervous system, but they can be found in our blood also. So testing. This is the frustrating thing. You could do like a finger prick, right? And what I found is that a lot of these filarial worms are nocturnal. So if you are going to have a blood test done, you should have it done at night between 10 p.m. and 4 a.m. That's where they're going to be out in the blood more, easier to pick up. And there can be a thick or a thin blood smear that's done. I would just love to get back into microscopy. It's just so fascinating. So these worms can be observed in stained or unstained slides. So they will take a glass slide and they will put like a little bit of your blood, and they will sometimes will fix it for sure. So that they'll make it so that it's not liquid. And then they will put, not always if you're doing live blood analysis, they won't, but depending on who's doing it and what kind of test. So sometimes they'll put staining on top of the fixed drop of blood, and that will pick up certain things so that it'll really stand out and they'll be able to see. So it can be stained, but they actually can see these worms in unstained slides also. And sometimes they will look under the microscope at either blood or they will look at urine. To detect adult filarial worms, sometimes they'll do a lymph node biopsy. So again, this is not going to be really common in developed countries because they're going to say, why do you think you have filarial worms? Why do you think you have these nematodes? That's something in another country. Have you been traveling? Oh, no, you haven't. You could not have. But then why do we treat our horses and our other animals for these types of worms, right? So frustrating. And then there is also a high frequency ultrasound or Doppler that you can also pick them up with. That lymph node biopsy, again, is not something that's going to be done very routinely. Immunological tests would be detection of filarial worm antigens. So those are like parts of the filarial worm through certain types of ELISA or rapid testing. There is an ICT test, antibody test, skin test, PCR test, sometimes looking at, elevated eosinophils, which is a type of white blood cell that's involved in going after parasites. So eosinophilia, if you have higher eosinophils. And then again, ideally, if you're going to do the finger prick or the blood test, to have that done between 10 p.m. and 4 a.m. And which labs are going to be accommodating that? I don't think very many. And then there is also, like, for somebody maybe who's had more chronic, where maybe these worms are kind of hiding and they're not going to be picking them up. I'm sure there's a lot of false negative tests, as there are with a lot of other types of testing for parasites. So there's a provocation test where you would give the patient some, and they're talking about DEC, that drug, and then 1 hour later collecting the blood. So sometimes if they give patients like a dose of a treatment, that will, again, remember the worms, they start wiggling and wiggling around. They might come out of their hiding places and then they're easier to detect in the blood. But also remember, at nighttime, they're easier to detect. They're out and about. They're night hawks. Okay, I'm going to go to your questions. So Sasha, you're very welcome. This is really important research. I just had a student today who actually had live blood analysis done, and they found these nematodes in his blood. And I've heard this from other people too. I've had pictures of this, and I've shared on different videos all of this before. Sometimes I think I might have done it a year or two ago. So Kathy, and I can't remember if this one person has MS or I don't think he even has MS. One student, Kathy, there seems to have been a reason why human doctors and vets are totally ignorant on bugs, curious, re ALS. Absolutely. Like, let's put it this way. If our doctors were trained on parasitology a little bit, not a lot, they don't even have to be trained a lot because you can still use labs. By now, we would have had much better lab tests if we would actually acknowledge that parasites are an issue in humans and more so in animals. But if our doctors were allowed to even look under the microscope, some of them would because they really care about their patients. And some of them would just be interested in it. But we have such a compartmentalized healthcare system. And there's a reason for that. That's why it is a multi-trillion-dollar industry. That is why there's over 80 autoimmune diseases. That is why cancer is soaring. And, these companies are becoming incredibly like empires, and people are suffering their whole life and they're dying prematurely. And it's just so big. It's really disheartening, but I do have a very strong faith in God. And I really believe that it's by the grace of God that we're doing this work, that He keeps showing us His wisdom every single day. I'm just blown away by it. And I really do believe that He is going to step in, and because there's so much corruption. I don't even have to tell you about that in this world right now. There's a lot of beauty, but there's a lot of corruption. There's a lot of evil. And we really need help because this is too big for any of us to try to bring change. But what you can do is you can decide what you want for yourself, right? We're coming close to the end of 2024. We've got like a couple of months left, and you can decide, do I want to live my life the way that I've been living it, or do I want something different? And the only way that it's going to be different is if you take a different path, like I did when I was first diagnosed with MS. I learned early on that it looked promising. I didn't have any guarantees that MS was an infectious disease, but it gave me a lot of hope. It made sense to me. And so I went on that path. And because I did that, I had another child. I have 7 grandchildren now. I'm back to riding horses again. It's a midlife or later than midlife crisis, because it's like, oh man, if I don't do this now, I'll never do this. So I'm just having the time of my life and just playing with my grandkids and riding a horse again and being around animals. We've got dogs and we've got chickens, so yes, they have parasites, and yes, I wash my hands, and yes, I periodically deworm, and I deworm my animals, and then I live my life, and then I am thoroughly enjoying them. And so you don't have to be paranoid about parasites, but you do have to decrease their population, decrease their presence in your body, and to really kind of understand the different types of parasites. So with the Live Disease-Free plan, again, we get ready to treat. And then when we're ready to start treating, we don't have good tests. So there was actually, one person that through live blood analysis, and he did see a parasitologist and something showed up, but that is so rare. What we do instead is we take common parasite drugs that are available, and then we take them to a practitioner that can do energy testing. And so instead of trying to figure out which parasites we have, we look to see which treatments we test well for, which treatments restore our balance in our energy and make us stronger. And then if we test well for several that treat filarial worms or roundworms or tapeworms or flukes, we probably have those different types of parasites. And so we use them, again, using a holistic approach, layering herbs and parasite drugs and oxygen therapy. And the results are truly miraculous. Like the pictures, again, that I have, and I'm going to share, I've got that on our website. You can even look up, I think it's MS and large roundworms, and you can see some of the pictures, what our students have passed. You can see intestinal flukes that our students have passed. Like it's coming from people that are just like, Pam, I'm a student in your program, and I'm not as sick as some of your students, and I really didn't think I had many parasites at all. But oh my gosh, when I started treating, I could not believe what came out of me, and my husband was shocked, and I was shocked. And that's what we see over and over again. It's truly shocking. And it's truly like, how can we live when we're passing 10, 20, 30, 40 big or more, but very often it's more than that, of these worms. And the filarial worms are the ones we can't see, but they can cause a lot of damage, especially in the central nervous system and in other parts of tissue. All right, so can you cover the counter dewormers? Okay, this book can cover, I don't know which one you're saying there. Sasha, is it possible to eradicate these from the central nervous system? Yes, because some treatments cross the blood-brain barrier. And then also you can make some herbal treatments, you can make them liposomal, meaning that they're like emulsified in fat, and they will, a percentage of that will cross the blood-brain barrier. So you can have some of the oxygen therapies, you can have some of the drugs and some of the herbs crossing the blood-brain barrier. So how do you treat toxins from these worms? There are binders. So chlorella is super safe for everyone to take, even pregnant women, according to all the practitioners I study under. And then also there are other binders like activated charcoal. That is easy to get access to, but don't take that long term. People use that short term to kind of get out of a crisis if they're starting and they're feeling terrible. If you had food poisoning, if you use activated charcoal ongoing, make sure to check. Some of you have detox supplements you're taking and it has activated charcoal, and that can bind to your fat soluble vitamins and make you deficient in certain, like vitamin A, vitamin E, vitamin D, etc. And that can make you sick too. Deficiencies can cause disease also. So that's why the activated charcoal is super easy to get access to. It's super cheap. It works really well, but use it sparingly, not every day for weeks and weeks and weeks. Ryan, how do you eradicate them from the brain or cerebral spinal fluid naturally? I honestly, we started naturally years ago, and then we learned about the parasite drugs. I think for real success, use a combination of things. But you do it in an order so that you tolerate all of these treatments well. So some people don't tolerate herbs or parasite drugs or the oxygen therapies because these parasites can cause a lot of Herxheimer reactions. So that's why we do the prep work. That's why we introduce the treatment slowly. We get energy tested to see which treatments we test best for. But it really requires strategy and layering of therapies, because you can't get a huge amount of herbs to cross the blood-brain barrier. I do love herbs. I would like to use herbs solely if possible, but at this point in time, the parasite drugs are extremely helpful. They're very well tolerated, and they are safe. Like some of them have been around for decades, so you just have to use them properly. Christine, yes, we know why they're not examining the blood, because the pharmaceutical companies are dictating what the med students are learning and how they treat us. Absolutely. They are way too involved in medical training. So, Sasha, yes, live blood analysis is a must for anyone. But just keep in mind too that the very best parasitologists say that these parasite drugs pick up about 10% of what we have. And that's the same with live blood analysis. A lot of people can have, so you're taking a tiny, tiny little prick of somebody's blood, and so much can be missed. So it's interesting to look at, the state of your red blood cells, and I've had it done before, and I thought it was really cool. But it's just one piece of information. And if you understand the limitations of all the testing we have now, and that's why we use a multifaceted approach. We look at our health history, the health history of our parents. We look at our symptoms, our disease diagnosis, and our energy test results. And then we could use things like this also. So all of that information together helps us to build a better plan. And the problem is, if you have live blood analysis done and they don't find anything, then you have this false sense of security. And this one parasitologist that one of my students used, the last person I referred to him, he missed the boat. And he's a really good retired parasitologist. And he said, no, you're clear. You don't have any worms. And then literally the day she got the results back from his lab, she passed this really big worm. She sent it in to him and goes, no, you do have worms. So this is the problem with testing right now. So, Cunia, I'm sorry. Uh, I'm sorry. So, what test should I tell my doctor to test me for parasites? You can have a stool test done. You can have DNA tests done. It will cost, like, if it's not going to cost you anything, there's no harm in doing it. But the very best stool test might pick up something like Giardia or like small protozoa like Blastocystis hominis or Entamoeba, but they're really not going to pick up. We've had students put worms that they have passed in stool samples and send them into labs, and they are completely ignored. And I've heard this from several different people. So it's a real mess. It's a real disgusting mess. And then in some places, like one of my students said, they don't even look for worms in British Columbia. I haven't checked that myself, but she's a very smart person and she was going to get tested. And she found out that they don't even look for worms in the stool test that she did in British Columbia, Canada, where we're at. Canada is a mess. BC is just, that's another story. We won't go into that. What's the best way to start this process? So what you would do is if you have a practitioner that really understands this, you can work with them. But the vast majority of even functional medicine doctors, naturopaths can't write prescriptions, but functional medicine doctors could, nurse practitioners could, but they really don't know much about these parasites, which is ridiculous. It's really sad, but they don't either. They might know about Lyme disease. They might know about Candida for sure, Candida and Lyme disease, and they might think that you have parasites, and so they might give you herbs and you might pass worms, but you will still be sick. That's what we have noticed is that, things like black walnut and cloves and wormwood, those are kind of like some of the more traditional parasite herbs, and you may pass worms, but you'll still be sick, and that's the problem. So if you don't have a practitioner that you know of that is really experienced in all of this, what I share, watch my masterclass training. Go to our website, livediseasefree.com. Watch my masterclass training. There I share all the steps that we take to recover. And then I share case studies. And then if you do need support, you can always reach out to me by filling out a form. And we do have the Live Disease-Free plan. And in that plan, we're teaching people how to play an active role in their healthcare. So we're teaching them how to access practitioners they need, what they don't need. And that's a big part of it, is really making it as cost-effective as possible. And then how to, access treatments, do it safely. And that's what we help people to do in the Live Disease-Free plan. So you can watch the masterclass training. And if you feel that you might want to consider our support, then you would fill out the form. Then we send you a video that's called the Coachathon, and watch that. And it goes into really deep detail about, how do we access treatments and practitioners. And I live in a different country than you, Pam. I live in Europe, and how does that work? So all of that is explained on the Coachathon. So then when you and I meet, then you have much better questions for me. So let's see here. I just missed. So thank you, Matthew. So try that. And so you're 45 years, you had MS since 29. You've tried everything under the sun. Matthew, this is your answer. And go to our YouTube. I think that's probably the playlist, and listen to some of the successes there. We have so many healthcare professionals that have been diagnosed with MS that have taken our program, tons of nurses over the years, especially, but right now we have an MD, we have a pharmacist who's very, very close to being completely symptom-free, and a naturopathic physician, and of course, nurses, etc. So they can't get better with our medical system. And I'll bet you've tried everything except for treating infections, treating parasites. Maybe you've done Candida or Lyme, but you have not treated these others. And go to our website, livediseasefree.com. Look at our blog. I have articles there. Pick and choose the topics. You can scan my notes. You can look at the shorter versions of these videos, and you will get it. You'll be like, oh my gosh, this is what I've been looking for. And it's just unfortunate that we haven't found each other earlier. So, hi, Charlie. How do you determine the dosage? Thank you so much. So there are dosages that are safe, and this is known by pharmacies, and it's basically by pharmacies. So the problem is there's some people that are on forums and they're trying like try fenbendazole and they're doing, or ivermectin, and they're just winging it and they're taking certain dosages. They're taking it for a couple of days at a time. They don't know what they're doing. They're a little bit nervous about doing it. That's a very bad idea. Number one, you could hurt yourself. Number two, what if those parasites become resistant to the treatments and then you can never use them again because they're not going to work? So you have to use safe dosages. Again, they're not going to cure one on their own. And even like I have done, 5 parasite drugs that I've tested well for at one time, didn't do any enemas. And then on the 7th day, did enemas thinking, surely I don't have any more parasites left. And lo and behold, that's when all the worms came out. So these drugs are toxic to the worms, but not necessarily lethal to all of them. And so that's why combinations is really important, dosages, combinations, and layering herbs and oxygen therapies together. You're so very welcome. So Matthew, the only relief that you've had is doing carnivore diet. Yes, and it's helped a lot, and I'm really happy. So you've decreased a lot of the carbs. So these parasites, they thrive on simple sugars and carbohydrates. Do you know the magnification with a microscope to do the finger prick? No, I don't. I'm sure that if you have experience in that area, I'm sure that you can find that pretty easily. If you look at studies of filarial worms, and you could even reach out to researchers and find out, how they're examining them under the microscope. I'm sure you could. I really would love to get into that, but I don't have the time. So one person is saying here, you've got to have colon work done right now. So I've got to have colon work done right now, and I have to eat some liquids. Should I wait until getting into the program? If you can do the testing that you're doing right now, if you want to. If it all depends on what you want to do. So if you really believe that this is your answer, the sooner you join, you can start asking me questions. Do I really need to do this, Pam? Like, for a lot of it, like if there's something that your doctor has found that's really questionable and you have to do something, or let's say you had this acute bladder infection, yeah, you treat that. Or if, there's a tumor and that's up to you and your doctor. But there are a lot of tests that are not necessary. And that's the benefit of working with us, is that I just give you the information and you make up your own mind. But you can save tens of thousands of dollars, some people hundreds of thousands of dollars, when you know what you need and what you don't need. And that is the whole point. I definitely wouldn't use ivermectin liquid on the face. I know that with cattle, they do a drench. I do know that with certain, I think it's rosacea, that a very low percentage of ivermectin in a cream helps rosacea. So that's another clue of parasites. So ivermectin will treat a lot of parasites. But again, if you're just winging it, I would not do that. Like, it's not safe. And again, what if you can't use it in the future? Over-the-counter dewormer helps. So there's usually like something like combantrin or mebendazole. There's usually like one over-the-counter dewormer in your country. And if you like for, what is it called? Those little tiny, what kids get. Sorry, I can't think of the name of them. But there's these little worms that children can get. And so you can use those, but it's not going to do enough for you. It's what is your goal? Is your goal to mess around and just try to, or is your goal like, I want to get back to my life in 2025. I am done with this. I want to get on with my life. I've had this sickness long enough. I've had these symptoms long enough. I'm not going to just be guessing and trying this and trying that, because honestly, none of us have recovered just taking one parasite drug. Not even ivermectin. It's not a cure. Neither is mebendazole or combantrin. Like, our students test well for 3 to 5 parasite drugs at a time. And they're using oxygen therapies and they're using the herbs. And that's when they're noticing life-changing, and they've done the prep work. That's when they're noticing life-changing experiences. Okay, last couple of questions here. Yep, the full lab work, the stool samples in your area, the obvious worms and eggs totally ignored. You've experienced that also. Thank you so much for sharing, Ryan. He is a wellness champion. And Julia, you're so very welcome. Stacy, just continue to add your questions. I'm going to let you guys go because we've got on a while here. But we've talked about candida, we've talked about Lyme disease, we've talked about filarial worms. So these are really significant parasites in multiple sclerosis, but also in other diseases, not just MS. And that's really important to know. Like, we've worked with students with ALS, with PLS, with Parkinson's, many different neurological diseases, and they test well for a lot of the same parasite drugs, and they are passing many of the same parasite drugs. They might have one or two different parasites they're dealing with, but there's a lot of similarities. And so if you are at the place where you're like, you're blowing my mind, Pam, like, I've never heard of this before. Like, this makes so much sense. This can't be. This is too good to be true. I challenge you to go to our website, livediseasefree.com, look through our blog posts. When you're ready, when you believe that this is the direction you need to go, then make sure to watch my masterclass training. It'll be above or below this video. It'll be right on the front page of our website too. And once you do that, then if you don't have support from a practitioner and you want a proven plan, you want to play an active role in your healthcare, you want to learn the skills so that when you are exposed to parasites after you recover, that you know how to take care of yourself for the rest of your life in the most cost-effective way, then make sure to fill out the form, chat with me, watch the coach-a-thon, and I'd be honored to support you. And what a Christmas gift to start your journey back to wellness, to start your journey back to doing the things that you love to do. So with that, I hope you have a wonderful week, and I'll talk to you next week on the next topic of these infections. Take care and bye-bye for now.